talk about women in general and the hormones in general and how that can affect their health. Today we have an amazing speaker and a very good friend of mine. And we are going to discuss a very important topic to everyone, not just women, but really everyone. Dr. Saha, Dr. Anita Saha, welcome to the Wonder Tooth podcast.
Thank you.
Dr. Saha, she is an undergrad at University of Michigan Medical School, Albert Einstein, College of Medicine in the Bronx, and she did a residency at the NYU Presbyterian. You did a lot.
New York Presbyterian, different than Cornell,
Yeah.
different than NYU. Yeah.
How long have you been doing medicine?
Well, sometimes it's hard for doctors to explain that because after medical school, you have to do a 4-year residency, right? I've been practicing OB-GYN after residency for over 15 years.
Wow. And you are an OB-GYN, so why did you choose that particular specialty?
I've always liked women's health, and I did not actually know I would be an OB-GYN. I thought maybe I would be an internal medicine doctor and focus on women's health. But then when I was in medical school, I realized how much I like to operate. And it's a really, really important, unique, great thing to have a connection with someone you're taking care of over a year or sometimes a few years when they're having their pregnancies and their babies. And it's a very unique thing that I think OB-GYN is the only thing that really has this, where you see patients quite frequently over a span of a year before they have a baby. So that connection and really getting to know the patients is only there with OB-GYN. Everybody else you see once a year, right? You never want to see your doctor more than that.
That's true. True. So a lot of our patients actually asked me to do a podcast specifically about menopause, about hormonal imbalances in women.
I think a lot of people do not realize that hormones affect every single part of a woman's body and at all phases of their life after they start their period, especially. So these fluctuating hormones after you start your period, in that time when you're getting these periods, your body is constantly cycling and changing. So I think a lot is known, as you know, about pregnancy and dental care, but I think people don't realize that from the time they start their periods, and because their hormones go up and down every single month, that their mouths and their gums respond to those hormonal changes on a monthly basis.
That is so true, especially if they are taking like birth control pills too, that can affect the gums like tremendously.
Yes. I have a
Well,
question about that. Can
sure.
you tell that, oh, this person's probably taking birth control pills? Like, can you tell when you're looking at someone's mouth?
Well, we usually definitely take a medical history, but the gums, yes, sometimes they can be really puffy. We have certain criteria for the gums. So if you look at yourself in the mirror, the gum really should be nice pink and like a knife edge going towards the tooth. So if this is the tooth, we want the gum to be like literally knife edge, not puffy and not, how can I, congested.
You're
And
saying very flush with the
very
tooth.
flushed with the tooth, completely. Yes, we call it knife edge. And we also like it, the orange peel appearance, the orange, like the little dots. If we see that on the gums, that's beautiful. Okay, that person is really taking good care of their gums. We call
Really?
it
That
stipple.
is the opposite in so many other parts of the body, that it's called peau d'orange, right? And in other parts of the body, if their skin changes like that, it's actually concerning for, why is there edema? That could be a sign of overlying on the skin of breast cancer. So it's interesting that that's the opposite, that you want that for the
You
gums.
want the stipple, yep. And then of course the big one really is when we start to touch around the gums, if there is bleeding. Bleeding is always a big sign for us. It's a sign of infection, signs of inflammation. So
And have you ever experienced, there's something that my patients tell me about it, and I'm not a dentist. So there are some patients who end up for whatever reason, always needing a lot of dental work. They're not
Hmm.
pregnant, but they will come in and they'll actually say, like, I have to get off this birth control pill because it's making my mouth dry, or and I had one tell me my dentist told me to get my tooth pulled during my period because there's less dry socket, and I had never heard that.
Because of the hormonal imbalances. Yes, absolutely. So dry socket is basically after a tooth is being pulled, it doesn't happen right away. It usually happens 4 or 5 days after the extraction happened. And it's most common in the lower jaw, not the upper jaw. And this is because the bone in the lower jaw is more dense, is more like cortical. Like the top, you have more blood vessels, you had more blood circulation, so there is more bleeding. So basically, what is really a dry socket? So the clot fails to happen, or even worse, the clot can happen and then it's gone. So the bone becomes naked, completely naked, and that can hurt, like it's very inflamed. And a big part of it is, yes, happens more in women and smokers. And of course, if you're diabetic, uncontrolled diabetes, that can happen too.
So it's a vascular thing, but
It's
for women, it's more common because not only is it a vascular thing potentially, it's potentially a hormonal thing.
Yeah, it's a combination of both. Yes. And some patients, if you don't really follow the instruction and you start to spit and, try to, oh my God, I have bleeding, let me rinse, let me rinse. So the clot's gone. And then the bone becomes naked. And that can lead to some serious consequences down the line, not just the pain, but also you can get inflammation in the bone. Necrosis then can start to happen.
So what
Necrosis when the bone
happens? Like
cells.
that clot dislodges, but what happened to the blood vessel? Like, how do you fix that?
How we fix it? This is a very good question. So the patient, of course, they have to go back to the dentist because we have to clean that area now, because I'm pretty sure food and debris and whatever started to get in there. Sometimes parts of the blood clots are still in there, but they are not complete. So we have to really numb the patient, and we have to go and scrape the bone. We have to flush the area first, and then we have to really scrape, because I want to see blood now. I want to see
So,
that
so I
red
have to
pig.
tell you, this
Mhm.
is where when patients come to me and they're like, "Oh, the gynecologist is so scary." I'm like, "Have you been to the dentist?" Because what you just said is very scary. I'm sorry, but this
We
this
have
just
to.
proves my point that the dentist is much scarier than the gynecologist.
No,
Everyone
no.
has heard it here.
And you know what?
Okay.
This is my tell me about an OB-GYN. I'll be like running. That's
Yeah.
my
No, there's
yeah.
none of this. Yeah. No,
Yeah.
I'm not scraping anything off of anyone's bone. I promise you that never happens. I generally don't touch bones, which is good.
We have to, yeah, we have, because we need blood circulation. So that's why also it's really common in smokers, because the blood vessels, the constriction, the vasoconstriction that happens, so there is not enough blood supply there. So we just need to see some more blood basically until it fills that socket. And then we put sometimes some medicine, put a gauze, and be like, you don't touch it. Do not touch it.
And then you can go to the gynecologist the next day and you won't even feel anything because you're still going to have mouth pain.
You're gonna still no,
Yes,
actually,
that's
right
actually a good
after that day,
suggestion.
after that day, there is no pain, really. And it's not an infection. It's not like you don't even need to take an antibiotic. It's not infected. It's just the bone is naked. Yeah.
And very sensitive.
Yeah.
But it gets better.
It
Like you
definitely
can
gets
fix it. Okay.
yeah, yeah.
Because it's not something, going back to this hormonal thing, it's not something where you're telling all of your patients who need teeth extractions that you have to wait till you're on your period, right? This is just
No.
a sort of a random thing.
Yeah, not really. No. You can get any teeth pulled anytime, really. The big thing is you just need to follow the post-operative instructions. Follow the instructions. That's the
Okay,
big
that's where
one.
we're
Don't
similar. I'll take
Yeah,
that.
please follow the
Okay.
instructions. Don't go and the big one is don't use a straw, because a straw can
We'll
dislodge
go.
that. Yeah,
Yeah.
it because it creates negative pressure. So it can don't rinse, don't brush that area that day. The following day is okay, but not that particular day. Yeah.
Well, I'm going to turn from things that are less scary and start talking about, for me, I actually have patients. So they come in and they want to talk about trying to get pregnant.
Mm-hmm.
Okay.
Mm-hmm.
And they are always surprised when I go through this checklist of things they need to do. And I say to them, have you gotten your 6-month cleaning from the dentist? And they're like, what does that have to do with anything? Right. And I tell them that initially, like right now, while you're not pregnant, it's not a big deal. But would you like to be pregnant and having a root canal or multiple cavities because you didn't address it before you're pregnant? And they keep asking questions about it. And the truth is, I just want everyone, if they can, if they know they're trying to get pregnant, to just get their dental cleaning, because that's where you're going to catch a cavity
Mm-hmm.
or have an early filling, or the dentist is watching something, and it prevents huge amount of problems in pregnancy. So plenty of people will tell you what they thought was like a little thing. Oh, I'm pregnant, I don't want to go to the dentist, i
I
don't
agree.
i don't want an x-ray, I don't want these things. Turns into a gigantic thing because the high progesterone in pregnancy causes gum inflammation, to
Mm-hmm.
your point. But that inflammation, it almost like seeds the blood vessels there because it's a
Mm-hmm.
very vascular place. So pregnancy accelerates any kind of existing gum disease and dent fillings, or need for fillings, excuse me. And if you get that stuff taken care of before you ever get pregnant, it's great, right?
Absolutely. I agree.
But it should not delay people from getting pregnant, right? So like if they get the dentist appointment in that month, fine. If they don't, they like if they get pregnant, you could still go to the dentist for your cleaning. Now actually I want to ask you, because I don't think I've ever actually asked the dentist this. If you find out when you're sitting there with your patient that that person is pregnant,
Mhm.
what do you do differently, or do you modify a routine cleaning?
No, the cleaning is usually the same. We don't really modify unless if there is something else, like another medical like condition, like pre-medicated or something. But usually it's a regular, like if they're getting like regular cleaning is okay.
Mhm,
Prophy, like polishing the teeth, that's okay. Deep
mhm,
cleaning, this is where we need to, okay. First trimester, I wouldn't. I would not do deep cleaning in the first trimester. I wouldn't do any routine dental work in the first trimester, but a cleaning is okay. But I wouldn't do a filling. I wouldn't do anything that's gonna, we just want to make sure that the first 12 weeks we are okay.
So with that,
Mm-hmm.
from an OB-GYN standpoint, I
Mm-hmm.
would tell them it's potentially okay to get a filling. But do you think in that month that they would wait for the filling, and within the second trimester, that there would be such acceleration of the cavity, or it would be okay?
No, we usually tell them, how to clean it properly and basically maybe get some, mouthwash, something that kind of some toothpaste too can kind of delay the cavity a little bit, especially if they have fluoride in them, they can kind
Mhm.
of delay the progression until we get to the second trimester.
And then I have a couple things that I do tell patients also.
Mm-hmm.
At the end of the cleaning, a lot of times fluoride is offered, and it is
Mm-hmm.
safe to do that in
Mm-hmm.
pregnancy. And then you mentioned something just now. What is the actual difference between a regular cleaning and a deep cleaning? And you define that as a procedure. And
Mm-hmm.
in what situation would that be indicated anyway, as opposed to a regular cleaning?
This is a great question because regular cleaning is basically when you come for a dental checkup, we have to check the gums. So we have to check some measurements. And basically, we go with the little tiny thing and we check
Mhm.
the height or the measurement from the top of the gum to the top of the bone. And usually, the proper measurement is 1 or 2 or 3 millimeter. So the tooth, there is a gum here. Remember, it needs to be nice and flush, but there is a tiny little pocket in that area, very small. And this is where
Just like
things
a
can
U?
get stuck.
Oh, right in the center of the tooth. That's where it makes the pocket. Got
Yes.
it.
So this is called the sulcus right here. So this
Mhm.
is the tooth, the gum is here, and that little area where it gets flushed here. So it's not completely attached. There is a little pocket. It's called the sulcus. But
Okay.
1, 2, 3 millimeter is fine. But if the bacteria gets in here and the plaque and the food debris get in here and we don't clean them properly or regularly, like the 6-month checkup and cleaning, then the bacteria is like, oh, I have food, I am having a party. So they start to go in and basically produce more acid and enzymes, and then that pocket becomes deeper. So this is when we start to get like a 4 or 5 millimeter. And then the gums on the same time starts to become more inflamed, a little bit more bleeding. So if you have no bone loss, the gum is, looks nice and pink, you can get a regular cleaning. If it becomes a deeper pocket, like 4 or 5 millimeter, we have bone loss that we can see on the x-rays and we are checking and there is bleeding all over. So this is when we need to say, okay, this is a gum infection. It's not just a regular cleaning, so a gum infection. So in order to do that, we cannot go and clean this like right away. You need to be numb for this. Now, for pregnant ladies, we like to use something without adrenaline. I like to use like a plain anesthetic with no adrenaline in it because we don't want any issues, basically. But that's just me. And I really, I really like to use that. So we just numb them. And we usually try to do one side at a time. So top teeth, bottom teeth in one appointment. And this is the deep cleaning.
I didn't realize that. I've never gotten a deep cleaning at your office. I've gotten a cleaning, a very nice cleaning,
Yeah.
and he's very good because he'll put like it's like almost like Ambisol. I don't know what it is, but he numbs it a little bit so I barely feel anything.
Yeah.
Which I would tell my patients is perfectly okay to have some sort of topical anesthetic if they need that for a gentle cleaning. And then I do warn them that most pregnant women in any trimester, if you manipulate their gums because of this high progesterone causing some inflammation, they are going to have bleeding. So I try to warn them that like they shouldn't be surprised, like when you guys say like sit up and spit or rinse, that they see a lot of blood. Like it's not a huge blood loss or anything, but I think it's surprising to some people that they see bright red blood during this cleaning because the gums, even some people when they brush their teeth, they see blood.
Yeah.
I have some patients who know they're pregnant because they brush their teeth and they start to bleed. Like they'll say to me, I knew I was pregnant. This always happens with my pregnancies. And the other thing I tell patients is don't skip your cleaning. And then I do have some patients who come in who are like, I need a root canal. I'm not going to get this. And I tell them the following thing. There is a statistical link. People with gum disease, people with dental disease and bacteria that is there. This is a highly vascular area of the mouth that seeds the blood, and people with significant disease, they are 7 times more likely to have a preterm baby. And that's bad because that baby wouldn't have been preterm. This gum disease sets this stuff off and you end up with a preterm baby, a baby potentially in the ICU because it's little. It's completely unnecessary. So sometimes the patients don't tell us that they went to the dentist, they might need this, but when they do, we always say like, you have to get this done. Like the dentist knows how to take care of pregnant women. I also tell them that if the dentist is worried you're pregnant, you may have to find a different dentist that's willing to treat you. Would you agree with that?
Yes, absolutely.
Yeah.
I think they need to get more cleanings actually when they are pregnant.